When it comes to toxic elimination from the human body, the liver and kidney plays a vital role. Your health is your wealth and therefore needs to be kept in constant check. Dr. Soliman Clinic and Labs offers you the opportunity to find out about your liver and kidney today. With us, you will have a free liver scan and hepatitis B test by ELISA just at 5,000 francs CFA. Find out the state of your kidney. With us, we offer free kidney scan, and if your creatinine is above 1.5, we have the solution. In addition to that, we also offer free medical consultation and free body scan. We are located in 2 cities. In Boya, we are located at mile 18 Bomaka. In Douala, you can find us at Bonaberry, precisely at Entrepilot. You can also reach us through the telephone number 694-940172. Your health is at the right place with Dr. Soliman.
Yes, good evening. This is Dr. Solomon, another session of Your Health Today with Dr. Solomon. Today we're going to discuss about something that has been disturbing a lot of us, something that is, if recognized early, could be very much preventable and treated. Today's session is going to be very important for you. We're going to throw the light on a lot of issues and a lot of precaution and prevention measures that you can take to avoid this kind of problem. We are talking about the kidneys. We are talking about a very important organ in your system called the kidneys. 120 grams, very small thing, but it does an amazing job. This amazing organ here filters out the blood many hundreds of times in a day, and it doesn't get tired, it doesn't need battery, it doesn't go bad unless you make it go bad. So let's talk about the kidney today. A lot of people in Cameroon and in Africa in general have kidney problems for different reasons, most of the reasons that affect the kidney, you are the reason. You causing those problems by ignoring simple advices that we have been saying, by taking things and putting things in your mouth. You don't know where it is coming from, you don't know what is the effect on the kidney. Even comes even to some health professionals prescribing medicine for a long periods of time, not knowingly that this medication for this specific period of time can cause kidney damage. We will be talking about the kidneys today, so I need your attention for the next few minutes. Any doctor's office right now today has what is called an ultrasound scan. You do not walk into an office today in the cities, in the big cities, without seeing an ultrasound in the doctor's office. So when the doctor consults you, take the history in order for him to see what else is there, or to confirm what you have said, or to confirm the list of suspicion that he has in his head, then he must do an ultrasound. We call it fast-track ultrasound. Fast-track ultrasound, the doctor or the health professionals know what they're doing. They will scan the whole organs, starting from the heart, the epigastric area, the liver, the kidneys, the prostate, the heart. Everything is fast-track. We look at everything quickly. Uterus, ovaries in case of female, prostate in case of male. We look at all those organs very quick to make sure everything is okay. Believe it or not, many cases that the patient comes just for a checkup and we found things that, wow, I didn't know I have this. So it is advisable every now and then, especially when you pass the age of 40, to do general, regular checkups using an ultrasound. And by the way, since it is the month of December, we have a very good promotion, which is we always have free consultation, free ultrasound. So I'm gonna throw for Christmas kidney check, that is kidney creatinine, to measure the kidney function. All right, so let's talk about the kidney. What is the function of an ultrasound? How can an ultrasound help me as a physician in recognizing kidney problems? Believe it or not, the best investigational study to know what is wrong with the kidney is the ultrasound. What do I get from the ultrasound? Number one, stones. That is number one imaging studies that we can see the stone, we can measure the stone, we can also tell where is the location of the stone just by simple ultrasound. Now, what is the damage that a kidney stone can do? We will be talking about kidney stone, what is the reason why we form in kidney stones, but let's talk about the consequence as far as in kidney injury when we have a kidney stone. When you have a kidney stone, what happened? That's an obstruction. And remember, when we talk about the kidney, the obstruction doesn't happen inside the kidney. There is only one chance of 3 other chances that obstruction can take place. We have the kidney that is mainly a cortex, which is the outer layer, and that is the most important layer. This where all the kidney function takes place, in that outer layer called the cortex. The second is called the medulla, okay, where it has small pyramids there. And then we have a pelvis, where the urine collect, and then we have a ureter, which is just a pipe that takes the urine from that kidney into a storage area called the bladder, and from the bladder then you let the urine outside. Okay, that is very much in a simple way the structure of the urinary system. So when we have a kidney stone, that's an obstruction to the urine. And when we have an obstruction to the urine, what happened as a result? The urine, instead of going down to the bladder, it backs up to the kidneys and it accumulates in the kidney. You know, the pelvis of the kidney is very small. So now when the urine backs up to that pelvis of the kidney, as a result, it will expand. So that now that small pelvis there will become bigger, and more urine to back up to the kidney, the pelvis becomes even more bigger. Now the pyramids of the kidney become filled with urine, and they expand more, they expand more, they expand more. So now what we have here, we have hydrostatic pressure. In other words, we have pressure, that obstructive urine that is not allowed to pass because of that obstructive stone now create back pressure on the pelvis of the kidney and as well the kidney. Which layer now is affected? If we have the medulla and the pyramids full of urine, which is the middle part of the kidney, has already been building pressure because of that back pressure coming from the accumulation of the urine ascending up to the kidneys. So what will be affected? The cortex of the kidney, the outermost layer of the kidney. As a result of that, we have just mentioned a minute ago, the function of the kidney lies in the cortex. The cortex of the kidney is the most important layer of the kidney. Now you have pressure pushing against that cortex of the kidney, pushing more against the cortex of the kidney, more and more and more and more and more. That extreme pressure, day after day, week after week, month after month, we will cause that cortex to deteriorate, to be injured, to be bad. As a result, we will lose the function of the kidney because we have injured the cortex as a result of leaving that urine accumulating for so long without intervention and getting the urine out. What is the rule? When we talk about the kidney, there is one very important rule that we have to say about the kidney, which is urine, 3 words, urine must flow. This is it. This is the rule for kidney. When the kidney form urine, this urine must flow. So the kidney then is the barrier, is that shifter between the blood in one side and the urine in the other side. The urine is the excessive water that you have, the body used what the body needs of water, the excess you urinate. Okay? All the toxins in the body, the blood being shifted in circles like this every couple of, when the cardiac cycle continue, that's also as every cardiac cycle that goes through, it goes through the kidney as well, and the kidney shifter that blood from all its toxins and the material that shouldn't be in the blood has to be shifted through the kidney. And since the kidney is a shifter, then that shifter has a specific size holes, has a smaller size holes. Why? Because there are stuff in the blood that it should be kept in the blood. Like when we discussed about the lady with ascites, we said the main reason this lady, and I think was the last session, the main reason that this lady is having ascites. By the way, I examined the lady today before I come, couple of hours before I come, and now she is fine. Why? How long did it take us? A week. What did we do? We give the special formula that I make, we call the gum, to reverse the bad kidney function. We give few medications, and now there is no fluid. I checked her today with the ultrasound. There is no more fluids in the abdomen. There is no more fluids in the legs. The legs are normal right now, and everything is happy. At least we have a smile on her face. Her family very smiling and happy, and the condition is reversing. Is not fully reversed yet. The condition is reversing, but is not fully reversed yet. As if you can remember, that lady has 2.6 albumin. And the problem was not the liver failing to make albumin, was actually the kidney not shifting very well and losing albumin to the urine. So the problem was not the production problem, the problem was excretion problem, losing kidney, that losing albumin that was not supposed to be lost, but it has been lost because of a bad kidney. The holes of the shifter get wider, so it loses big molecules like the albumin. So that's when we say the kidney has to have a specific size bores. The shifter has to have a specific size. It allows things to pass, and it doesn't allow other things to pass. What's supposed to stay in the blood is stay in the blood. What's supposed to leave the blood to the urine leaves the blood to the urine, and that is the main function of the kidney. So when we say the main rule for when we talk about the kidney is urine must flow, then anything that obstructs the flow of the urine will cause me problems. Now, when we talk about obstruction, we have three main gates, three main constriction areas that the stone can get stuck. We will talk today about how can a stone form, what makes a stone form. Anyhow, the stone doesn't form, boom, overnight becomes a stone. No, it's small sand, small dust that becomes sand, then becomes gravel. Then those pieces of gravel coalesce together to make a bigger stone. So the same way it forms by our treatment, the same way we break it into parts. To grab, we loosen the adhesion between each small calculi and the next. We break them apart to the original pieces, which is dust, and then down to the urine. Sometimes we get the whole stone down, and we have a sample, we have a stone. I have few stones actually in the clinic that I forgot to bring to share with you to show you how the stone look like. Even some of them is above 11 millimeters that we have dropped in the urine. So back again, we have three areas of constriction in that urinary system where the stone can get stuck. First one is up in the kidney, right after the pelvis. After the pelvis comes the pipe that will take the urine down to the bladder. We call that ureter. So before that pipe enters the bladder, which we call the bladder inlet, which is the gate into the bladder, we have a constriction. The stone may get stuck there. That is the second constriction area that the stone may get stuck. The third one is at the bladder. When the urine exits the bladder, we call that the bladder outlet, and the stone can get stuck there. So those three main constrictive areas where the stone can get blocked, and those are the areas that if the stone passes through those areas, the stone is out. As the stone passes through the ureter, it scratches the ureter, causes a couple of drops of blood to be in the urine, so you may see dark urine, brownish urine. And it's all because as the stone comes through the ureter, it causes a couple of drops to be present in the urine. No alarm, that's a good thing, the stone is dropping. But those who have kidney stones, yes. So this is a diagram, a nice diagram that shows the kidney pelvis, which is the black area there, and those two pipes going to the urinary bladder. Those actually what is called the the inlet of the bladder, and then down below will be the outlet of the bladder. As you can see, there is a stone there in the ureter. As the stone goes down, it scratches off the ureter. And as it scratches off the ureter, not only that you will see blood in the urine, but you will feel a lot of pain. And the kidney pain, the colic pain of the renal colic pain is the worst kind of pain you wanna have. It's very traumatizing, that you have to take an injection of analgesic immediately and something to release the spasm. Okay, so it's a very painful pain, but it doesn't last. It stays for a few minutes and then it goes off, and few minutes later you get it again. It depends now how the stone is moving. Till the stone is out of the bladder, the pain will stop. As long as the stone is moving through the bladder, through the ureter, then you will get the pain. So now we discussed the kidney stones. You know, we have not discussed it fully yet, because we need to know, and we will know inshallah today, how the stone forms, at what makes the stone to form. Myself, I'm a stone maker. I make stones. My body makes stones, and we'll discuss my case and your case, or whoever, anybody who is similar. So we're gonna see. I haven't had stones for many years. We thank Allah for that. But you know, we will see how can we prevent the stone from happening. Very simple, very simple. So now, we've seen the stones. We've seen when the stone passes, what kind of dilemma you go through. And we see also the bad consequence of having a stone for a long time, which is when we have accumulation of the urine inside the kidneys, a condition called hydronephrosis. Hydro means water. It's not really water, it's the urine. So, but we call it hydronephrosis, meaning water inside the kidney, which is, it has degrees now. We have grade 1, 2, 3, and 4, you know, so, and that the higher degree we get, the more damage that we can cause the cortex. And that's what we do not want to get to that point. So the minute we have a stone, we need to drop the stone before we reach to hydronephrosis. So we talked about the stones. We talked about how we can see a stone. The best way is, doc, I have a pain in the waist. I want you to see if you have a stone, because that is the most common presentation. Waist pain. My waist is paining. Now there is different kinds of waist pain. The colic renal pain is, colic mean comes and goes. Is episodic. It comes, like we discussed a minute ago, as the stone moves. And it goes when the stone stops moving. So colic, episodic, comes and goes. There's different kind of waist pain than when we have degenerative disc, for example. How would you know you have a degenerative disc or not before spending hundreds of thousands of money on MRI and CT scans and all that stuff and all this investigation? Basically, you lie down in your back. You have somebody lift your leg. Somebody has to lift your leg without resistance from you. And we see how far this leg can come to your abdomen. Once the leg comes very close to the abdomen and you get the waist pain, you have a disc problem. You do the same maneuver with the other leg. You raise the leg all the way almost to touch your abdomen. If you get waist pain, then you have a disc problem. Then we recommend that first we do an x-ray and to see what is there. If we need to go more advanced, then we'll order more advanced imaging studies. If you get the pain only on the thigh, that is not a problem. If you get the pain on the buttocks, that is not a big problem. There is a problem, but at least it's not a disc problem. And so on. So that's an easy way when we talk about waist pain, what you should do at home to find out if there is actually a disc problem or there is just, you know, a waist problem. A waist problem meaning a disc problem. And the other kind of pain, that comes and goes, and that is most likely related to a stone passing through.